Vaginal yeast infection. Do you have a vaginal yeast infection? If you do, you have experienced the annoyance and embarrassment that make it difficult for you to carry on with your daily life. As a starter, you'll be making frequent visits to the bathroom to take secretive scratches of that itch and to apply more of that cream, which can be messy, to stop the burning sensation down there, that never seem to want to go away. Not to mention putting sex on hold, as intercourse can be painful and off-putting with the presence of the thick, white, odorless, creamy discharge from the vagina. The Center for Disease Control in the U.S. found that about 75% of women get at least one occurrence of vaginal yeast infection in their lifetime. What causes a vaginal yeast infection? A vaginal yeast infection is also known as vaginal candidiasis, vulvovaginal candidiasis, or Candida vaginitis. Your vagina naturally contains a balanced mix of yeast, including Candida yeast, and bacteria coexisting in harmony and performing useful work when your immune system is strong. In a strong environment, bacteria lactobacillus prevent any overgrowth of the Candida albicans and to maintain vaginal health. When that delicate balance is disrupted, the Candida albicans yeast overgrow and penetrate into the deeper vaginal cell layers and cause the symptoms of the vaginal yeast infection that the victim experiences. The Candida albicans yeast overgrowth can result from antibiotic use, which causes an imbalance in natural vaginal flora. Pregnancy. Sometimes the hormones go out of whack. Uncontrolled diabetes. Too much sugar in the blood. An impaired immune system. A weakened body cannot fight off the infection. Taking oral contraceptives or hormone therapy that increases estrogen levels. How to prevent vaginal yeast infection. Here are some tips to help prevent the overgrowth of Candida albicans yeast, which causes vaginal candidiasis. Yeast loves sugar and strives on it, so limit the amount of sugar, sugary products, and processed foods that you consume. Processed foods have a lot of added sugar and salt in the form of dextrose, maltose, trans fats, and hydrogenated oil that you see on food labels. Wear loose-fitting, cotton underwear that minimizes sweating and keeps the vaginal area dry and fresh. Yeast infection loves warm, moist areas. Don't spend extended periods of time in wet clothes or bathing suits. Candida yeast grows in warm, moist environments. Only use antibiotics when necessary. Antibiotics kill the bad and good bacteria alike. The vagina needs good bacteria to prevent Candida overgrowth. Don't use douches unless advised by your doctor, and avoid vaginal deodorant sprays and scented vaginal lotions. They may alter the balance of good bacteria and yeast in your vagina. Diagnosis of vaginal yeast infection. In order to diagnose vaginal yeast infection or vaginal candidiasis, a healthcare provider will normally take a small sample of the vaginal discharge and have it examined under a microscope in a medical office or sent to a laboratory for a fungal culture to determine the type of fungus causing the yeast infection. Identifying the fungus can help the healthcare provider to prescribe more effective treatment and for recurrent yeast infections. Treatment of vaginal yeast infection. Vaginal yeast infection is usually treated with antifungal medicine applied inside the vagina. Or a single dose of fluconazole diflucan, link mentioned in the description, taken by mouth. Other treatments may be needed for infections that are more severe, that don't get better, or that keep coming back after getting better. These treatments may include more doses of fluconazole taken by mouth or other medicines applied inside the vagina, such as boric acid, nystatin, link mentioned in the description, or flucytosine. To learn more about Candida yeast infection and how to get rid of the symptoms of yeast infection in 12-hour and the yeast infection itself naturally and permanently in 2 months, click on the link below. www.alexand.com. Antifungal resistance to Candida. Here is an excerpt from the Centers for Disease Control and Prevention (CDC). Antifungal resistance is an increasing problem with the fungus Candida, a yeast. Candida infections may resist antifungal drugs, making them difficult to treat. About 7% of all Candida blood samples tested at CDC are resistant to the antifungal drug fluconazole. Because of this increase in resistance to antifungal drugs in the treatment of yeast infection, much research is being conducted on products that can be effective as home remedies to get rid of yeast infection. Here are some of the products and their effectiveness in killing the Candida albicans overgrowth and getting rid of the Candida yeast infection. 1. Greek yogurt. Probiotics can be effective against the overgrowth of Candida albicans and the resulting vaginal yeast infection. Yogurt is a probiotic because it contains live bacteria, such as Lactobacillus acidophilus. These bacteria are essential to creating a healthy environment in your vagina. They can help to effectively treat a Candida albicans overgrowth caused by an imbalance of the flora in the vagina. A study in 2017 confirmed that eating yogurt increases the microbiome in the gut, reducing the yeast in the body. Plain Greek yogurt is the best kind to use for this home remedy. Make sure that the yogurt doesn't contain added sugar, which fuels the growth of the Candida fungus. 2. Boric acid. Boric acid is a powerful antiseptic that some women claim is useful for treating yeast infections that are resistant to other remedies. Topical boric acid is recommended by the Centers for Disease Control and Prevention (CDC), trusted source as treatment for vaginal infections. Boric acid suppositories, link mentioned in the description, may also be used with medications to treat vaginal infections. Boric acid is toxic in large amounts. It can lead to kidney damage, acute failure of the circulatory system, or death if you absorb enough of it. To avoid this, don't use boric acid on broken skin and don't take it orally. If you're pregnant, you should not use boric acid in any form. For those with sensitive skin, this may not be a good choice. Discontinue use if any discomfort begins. 3. Probiotic suppositories and supplements. Probiotics help restore the bacteria-yeast balance throughout your body. If you start a regimen of oral probiotics that contain strains of the Lactobacillus acidophilus bacteria, you can bring your digestive tract and vaginal flora back into alignment. Eating yogurt is one way to increase probiotics as stated. Oral supplements take about 10 days to reach full effect, so some women use probiotics as vaginal suppositories to see results more quickly. If you want to try vaginal probiotics, you can get it by visiting link in the description. Probiotic suppositories have also been shown to be effective for treating vaginosis, according to Harvard Health. 4. Coconut oil. Coconut oil is a fatty oil derived from the flesh of the coconut. The oil has many health benefits, including antifungal properties. Studies have shown that coconut oil is effective against Candida albicans, making this home remedy one of the few with strong evidence that it actually works. A 2007 lab study trusted source found that coconut oil helped kill a species of yeast. Researchers found that the Candida albicans strain was the most susceptible to concentrated coconut oil. To treat a vaginal yeast infection using coconut oil, be sure to buy pure, organic coconut oil. You can apply the oil directly to the affected area. 5. Tea tree oil. Tea tree oil is an essential oil that's used to kill fungi, bacteria, and viruses. Research trusted source shows that a vaginal suppository containing tea tree oil may help treat vaginal infections. Tea tree oil has been shown to have antifungal properties. A recent study also found tea tree oil to be effective as an antimicrobial and in helping break down the biofilm. Tea tree oil is incredibly powerful. Make sure to dilute it with a carrier oil, such as jojoba or coconut oil, if it's going to touch your skin. Already prepared tea tree vaginal suppositories are the best option. Only use tea tree oil occasionally, and never swallow it. If you have sensitive skin, do not use tea tree oil. Discontinue use if any discomfort occurs. You can buy tea tree oil online and in stores. You can get the best choice by clicking the link mentioned in the description. Tea tree oil should never touch the skin undiluted. 6. Garlic. In a 2005 lab study, trusted source, garlic was shown to be an effective Candida killer. But there's debate over whether it'll help cure yeast infections outside of a lab setting. If you'd like to try garlic to treat a yeast infection, add more garlic to your diet. Some websites recommend inserting garlic in the vagina, but burns and significant pain have been reported. You should stick with adding garlic in foods. 7. Vitamin C. Vitamin C is an immune system booster. A strong immune system allows your body to bring itself back into balance. Vitamin C, also called ascorbic acid, has antimicrobial components, so some women add it to their diet to treat Candida overgrowth. Try increasing your intake of vitamin C to boost your body's ability to beat the yeast infection. Do not apply the acidic vitamin C to the sensitive vaginal tissue. Conclusion. Home remedies may or may not work to treat your yeast infection. If you use herbs, supplements, or essential oils, be aware that the Food and Drug Administration (FDA) doesn't monitor these for safety, purity, and quality. Buy from a reputable source. The effectiveness of a home remedy varies depending on the person, the severity of the infection, and the quality of the treatment used. If you have recurring vaginal infections, talk to your doctor about more natural approaches to preventing and treating this. Be sure to keep in mind that any product, natural or otherwise, may irritate sensitive vaginal skin. You should stop using the remedy and call your doctor if you experience any irritation or discomfort. Medical researcher, nutritionist, health consultant and former yeast infection sufferer, Linda Allen, teaches you how to treat your Candida yeast infection quickly and naturally within 2 months, gain complete relief in as little as 12 hours. To learn more, click on www.alexand.com and subscribe to my free email mini course. And gain access to Linda Allen's bestseller ebook in the description below. It is a surefire, 100% guaranteed, clinically researched system that is backed by 35,000 plus hours of nutritional expertise for tackling yeast infection for good. This is a very rare, highly unique and potently powerful Candida infection treatment system, which very few people even know exists. It is about how to treat your Candida yeast infection permanently, and regain your health and well-being, without drugs, without typical yeast infection treatments, and without any side effects. Click now on www.alexand.com.